Welcome to Robert Morris University's official illicit drug training. This training is required by the federal government and mandates that all incoming students must participate in this training.
The purpose of this training is to spread awareness and educate students on local, state, and federal laws regarding illicit drug usage and the potential health risks of using illicit drugs. Additionally, our goal is to make every student aware of the resources that are available to them.
We encourage all students to be active bystanders and seek help when they or their peers are in need of medical or psychological assistance. You will watch this video and then answer a couple of short reflection questions at the end. Remember that you are required to complete this training in order to pass your FYSP class.
Before we begin, we want to advise that this training discusses the effects on your body and mind that are caused by the use of illicit drugs. You are able to pause the video and come back at any point, so if you need to step away from the video, you are welcome to.
If for any reason you're unable to finish this video due to triggers that may appear in this video, please contact the Counseling Center at 412-397-5900.
Let's begin.
An illicit drug is an illegal substance that is used recreationally. Illicit drugs can either be prescription drugs that are being used by a person or reason they were not prescribed for. Additionally, illicit drugs are those that are illegal to make, sell, and consume. Common examples of these drugs include, but are not limited to, opioids and narcotics, stimulants, sedatives, alcohol, cannabinoids and marijuana, hallucinogens, club drugs, depressants, and tobacco. We will not be discussing alcohol in this training since you are receiving another training focused on alcohol use and abuse. Let's discuss the common names for these types of drugs and the health risks that are associated with each of them.
Opioids and narcotic drugs are often prescribed to patients, but are also often stolen from or given away by the patient who they were prescribed to, sold illegally, or misused. Opioids and narcotics often go by the names Oxycontin, Vicodin, hydrocodone, heroin, Percocet, codeine, and morphine. There's a wide range of health effects that one could experience if they use an opioid or narcotic. These health effects include sedation, respiratory depression, drowsiness, inability to concentrate, apathy, slowed physical activity, slowed breathing, constriction of the pupils, flushing of the face and neck, constipation, nausea, vomiting, or death. 4 out of 5 heroin users reported that their drug use started with legal prescription opioids. 10% of all Pennsylvania overdose deaths occurred in those between the ages of 15 and 24. Fentanyl has been identified more commonly in deaths of those between the ages of 15 and 24, along with benzodiazepines, prescription opioids, and cocaine. Fentanyl, however, is a prescription drug commonly used to treat pain, but in some cases, being made and distributed illegally.
Stimulants are often an illegally made and distributed drug and are commonly known as cocaine, amphetamines, or methamphetamines. MDMA is chemically similar to the stimulant class of drugs and is a form of ecstasy that often goes by the name Molly. The Center for Disease Control reports that there has been a rise in the use and the toxicity of methamphetamines locally and nationally. Other stimulants are cathinones, commonly known as bath salts, and acid. When abused, prescription stimulants such as Ritalin and Adderall are often called speed or uppers. These drugs can lead to addiction. Stimulants have a wide range of health effects that include, but are not limited to, injuries, facial burns, agitated delirium, very high body temperatures, hallucinations, seizures, lung injury and failure, kidney and liver failure, brain hemorrhages, heart attack.
We've talked a bit about stimulants or uppers. Now let's talk about sedatives or downers. Sedatives and depressants are often prescribed to patients but have been known to be misused or created synthetically. Sedatives and depressants can have various effects on people, including deep sedation, loss of memory, slurred speech, staggering, impaired decision-making, lung injury, lack of oxygen, and death. Prescription sedatives include benzodiazepines and barbiturates and can be called Xanax, Ativan, Klonopin, Valium, or Restoril.
Hallucinogens temporarily disrupt communication between brain chemical systems throughout the brain and spinal cord. Hallucinogens interfere with the serotonin in the brain, which regulates mood, sensory perception, sleep, hunger, body temperature, sexual behavior, and muscle control. Commonly known hallucinogens are LSD, PCP, mushrooms, ketamine, mescaline, and salvia. Some hallucinogens interfere with the glutamate of the brain, which regulates pain perception, responses to the environment, emotion, learning, and memory. Short-term effects of using hallucinogens include increased heart rate, nausea, intensified feelings and sensory experiences, changes in sense of time, increased blood pressure, increased breathing rate, increased body temperature, loss of appetite, dry mouth, sleep problems, mixed senses such as hearing colors or seeing sounds, spiritual experiences, feelings of relaxation, detachment from self or environment, uncoordinated movements, excessive sweating, panic, paranoia, and psychosis. Long-term effects include speech problems, memory loss, weight loss, anxiety, depression, and suicidal thoughts, persistent psychosis, and flashbacks.
Many of the drugs we've discussed so far are also considered club drugs. The most common club drugs are MDMA, ecstasy or Molly, methamphetamines, meth, and LSD, acid. The misuse of these drugs can cause serious health problems that may lead to death. These drugs are often mixed with alcohol, but should not be. No club drug is safe due to variations in purity, potency, and concentration. Rohypnol or roofies are a date rape drug that are often used in club or party settings. Date rape drugs are drugs that are illegal and are used with the intent to commit a crime, most commonly sexual assault. The difference between a club drug and a date rape drug is that a club drug is one that alters one's reality and perceptions to enhance their experience, while a date rape drug can completely wipe one's ability to comprehend and remember anything.
Cannabinoids are most commonly known as marijuana and are often called weed. There has been an increase in prevalence of marijuana since early 2015. There was an increase in synthetically made marijuana in 2016. There's a great amount of variations in marijuana makeups, and there have been multiple reports of deaths, hospitalization, and intubation due to use. People who use marijuana often do not know what other chemicals have been put into the makeup of the dose. There has been an increased prevalence of synthetic marijuana on Robert Morris University's campus. Synthetic marijuana is known to cause psychosis and other harmful psychological issues. Cannabinoids cause problems with memory and learning, distorted perception, difficulty in thinking and problem solving, loss of coordination, altered senses, altered sense of time, changes in mood, impaired body movement, impaired memory, hallucination when taken in high doses, delusions when taken in high doses, and psychosis when taken in high doses. Despite recent developments in medical marijuana, it is still illegal by federal law to make, sell, and consume marijuana. Federal laws regarding the use of marijuana still apply on Robert Morris University's campus, and legal action can be taken on a local, state, or federal level.
Anabolic steroids are able to be prescribed by doctors for very specific reasons, but have been found to be misused by bodybuilders and athletes. Unlike other drugs, anabolic steroids do not provide a high that increases dopamine in the brain, but are still addictive. While some of the short-term effects may be desired, others include paranoia, irritability, delusions, and impaired judgment. The long-term effects include significant changes in mood and behavior, liver damage, kidney problems, and heart problems. Other long-term effects show up differently depending on gender and age.
Tobacco is most often found in cigarettes and is legal for use by anyone over the age of 18, and while there are little to no effects on one's psychological state, there are many health risks associated with smoking tobacco. These risks include increased blood pressure, increased breathing, increased heart rate, cancer, bronchitis, emphysema, heart disease, leukemia, cataracts, and pneumonia. Robert Morris University prohibits any type of smoking or vaping indoors. Our policy states, it is Robert Morris University policy that no smoking is permitted at any time inside university buildings, residence halls, offices, university vehicles, or any other interior space. Smoking is not permitted within 15 feet of any entrance door, open window, or air intake. Individuals desiring to smoke may do so in the designated areas where ash receptacles are located. Violators of this policy are subject to appropriate disciplinary action. Smoking is defined as inhaling, exhaling, or holding any lighted cigarette, cigar, pipe, or similar product or device. This policy includes hookahs, vaporizers, and electronic vapor devices.
Now that we've discussed illicit drugs and their health effects, we want to take a closer look at the code of conduct that is set by Robert Morris University regarding illegal drug use. The Student Conduct Handbook says, "The use, possession, or distribution of narcotics or other controlled substances is prohibited, except as expressly permitted by law on university premises, and is considered contrary to the Student Code of Conduct. Paraphernalia associated with the use of illegal substances is not permitted on university property or at university-sponsored events. Hookah pipes and/or other legal smoking devices are prohibited in the residence halls."
There are two entities on campus that enforce policies and laws regarding drug and alcohol use. They are the Dean of Students' Office and University Police. The Dean of Students' Office enforces the Code of Student Conduct, which reads, "Individuals charged with use, possession, or distribution of narcotics or other controlled substances can be disciplined under the university student conduct process and may be prosecuted under Pennsylvania criminal statutes. Even if the criminal justice authorities choose not to prosecute, the university can pursue disciplinary action which may result in dismissal from the university." The various sanctions that can be assigned by the university can be found online. It should be noted that use, manufacturing, or distribution of illegal substances can lead to expulsion. University police enforce state and federal laws that exist for the possession, use, and distribution of illegal substances. Most drug offenses are handled at the state level, although federal agencies can take over a case at any time. State and federal law state that penalties include heavy fines and jail time dependent upon the amount of the substance, number of previous violations, and type of drug. It is important to note that if you are found in possession of, distributing, manufacturing, or using illegal substances, any combination of or all entities can assign sanctions. It is important for students to be aware that federal or state drug conviction can disqualify a student for Title IV aid, including federal loans and federal grants. A student who has been convicted of possession or sale of illegal drugs loses Title IV eligibility for a period of time specified in law. The period of ineligibility depends on whether the conviction was for possession or sale of, including conspiring to sell, illegal drugs. For convictions involving possession, the periods of ineligibility are as follows. One conviction is 1 year after the date of conviction. Two convictions is 2 years after the date of the second conviction. 3 or more convictions are indefinite from the date of the third conviction. For convictions involving sale, the periods of ineligibility are as follows. One conviction is 2 years after the date of conviction. 2 or more convictions are indefinite from the date of the second conviction.
Sanctions from the university will be distributed through the Dean of Students' Office. The Robert Morris University Counseling Center offers 3 different classes for students who receive alcohol and drug sanctions. The programs are Alcohol 101, Alcohol 102, and Drug 101. The 101 programs educate participants about the effects and consequences that result from drug and alcohol abuse. They are designed to prepare students to make informed decisions about their choices to use these substances, and they further explain the resources available on and off campus. Alcohol 102 is a one-on-one meeting with a therapist to discuss personal alcohol usage. Alcohol 102 is assigned to those who have received a previous alcohol sanction and have completed Alcohol 101. Local drug and alcohol treatment centers are available for students, staff, and faculty. These centers include Greenbrier Treatment Center, Gateway Rehabilitation Center, Jade Wellness Center, and Glen Bay. National resources include Alcoholics Anonymous, Narcotics Anonymous, Half of Us, and collegedrinkingprevention.gov. The National Drug Abuse Helpline is 1-800-662-4357, and you can also visit alcoholaddictioncenter.org for information about alcohol use disorders and treatment. A counselor is available to refer students to treatment centers and resources that best fit their needs. Additionally, we encourage and expect all students to be good Samaritans and active bystanders. If you see someone in need, take action and get them help by calling campus police if you are on campus or 911 if you are off campus. You can find resources about alcohol poisoning and drug overdose symptoms on the Counseling Center's website under the Drug and Alcohol Resources tab. The Drug and Alcohol Resources tab includes information about the Pennsylvania Medical Amnesty Law, which reads, "The Pennsylvania Medical Amnesty Law provides intoxicated minors under 21 amnesty if they call emergency responders due to a friend experiencing alcohol poisoning." In order for the students to receive amnesty, they must comply with all of the following. The students must believe the person they are calling for is in need of immediate medical attention. The student must be the first to call the university police at 412-397-2424. The student must comply with the police and give their name and the name of their friend. Only one person is able to stay with their sick friend, and they must remain with the person in need of medical attention until help is received.
Robert Morris University is staffed with employees who are dedicated to a healthy and positive experience for all students and are committed to helping those in need. If you or someone you know are struggling with addiction, please call the Counseling Center at 412-397-5900. The counselors are available between 9 and 5 Monday through Friday and serve as a confidential resource and aid in the treatment of substance abuse. Seeing a Robert Morris University counselor is free for students.
Our hope is that RMU's Declaration of Integrity holds true for you, that you will devote yourself to becoming an upstanding member of this institution by making decisions that maintain the integrity of the RMU community. College is a chance to make incredible memories, but illegal drugs could literally cost you everything you've worked for to this point and destroy your dreams after college. Be smart. Be safe. Here's to an awesome, drug-free RMU experience. Go Colonials.